Veltin Gel is a combination medication used to treat acne. It helps decrease the number and severity of acne pimples and helps pimples that do develop to heal more quickly. Tretinoin, one of the active ingredients in Veltin, belongs to a class of medications called retinoids. It works by affecting the growth of skin cells. The other active ingredient, clindamycin, is an antibiotic that stops the growth of bacteria that cause acne. It is typically recommended to apply Veltin Gel once daily, in the evening, on clean, dry skin. Before using Veltin Gel, make sure to wash your hands and clean the affected skin with a mild cleanser. Then, apply a small amount, about the size of a pea, in a thin layer over the face, once daily at bedtime. Avoid the eyes and lip area, and do not apply to cut, scraped, sunburned, or eczema-affected skin. Only use this medication on the skin, and be careful to avoid getting it in your eyes. If you do get it in your eyes, flush with water and contact your doctor if irritation develops. Remember to wash your hands after applying the medication to avoid getting it in your eyes accidentally. In the first few weeks, your acne may appear worse, but this is normal as the medication is working on pimples forming inside the skin. It may take several weeks to notice results from this medication, so be patient. Use Veltin Gel regularly at the same time each day to get the most benefit from it. Do not use more than recommended, as it will not improve your skin any faster and may increase the risk of redness, peeling, and pain. If your condition lasts or gets worse, make sure to contact your doctor. When using Veltin Gel, you may experience skin redness, dryness, itching, peeling, mild burning/stinging, or worsening of acne in the first 2 to 4 weeks. These effects usually decrease with continued use. If your skin becomes very dry, using a daytime moisturizer may be helpful. If any of these effects persist or worsen, inform your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. Most people using Veltin Gel do not experience serious side effects. However, you should contact your doctor immediately if you experience blistering/crusting of the skin or severe burning/swelling of the skin. In rare cases, Veltin Gel may be absorbed into the bloodstream and cause a severe intestinal condition due to a bacteria called C. difficile. Contact your doctor immediately if you develop persistent diarrhea, abdominal or stomach pain/cramping, or blood/mucus in your stool. Do not use anti-diarrhea or opioid products if you have these symptoms, as they may make the symptoms worse. While a serious allergic reaction to Veltin Gel is rare, seek medical help right away if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. If you notice any other effects not listed above, contact your doctor or pharmacist. Before using Veltin Gel, it's important to talk to your doctor or pharmacist about any allergies you may have to clindamycin, tretinoin, lincomycin, or vitamin A-related drugs. This medication may contain inactive ingredients that could cause allergic reactions, so it's essential to discuss this with your pharmacist. You should also inform your doctor or pharmacist about your medical history, especially if you have certain intestinal problems or eczema. Veltin Gel may make your skin more sensitive to the sun, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen daily. You should also wear protective clothing when outdoors. If you get sunburned or experience skin blisters/redness, it's important to let your doctor know. While using Veltin Gel, it's best to avoid electrolysis, waxing, and chemical depilatories for hair removal on the treated areas. If you have recently used products containing sulfur, resorcinol, or salicylic acid, it's important to use Veltin Gel with caution and wait until the effects of such products on the skin have decreased before using this medication. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, Veltin Gel should only be used when clearly needed, as it may harm an unborn baby. It is also unknown if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how Veltin Gel works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, it's best to avoid using other skin products that could be harsh, irritating, or drying on the treated area. This includes hair perming solutions, alcohol/lime/menthol containing products like astringents and toners, medicated or abrasive soaps, and cosmetics with a strong drying effect. Also, products containing sulfur, resorcinol, or salicylic acid should be avoided. Furthermore, benzoyl peroxide can be very irritating and may decrease the effectiveness of Veltin Gel if applied at the same time. It's important to talk with your doctor or pharmacist about using prescription and non-prescription benzoyl peroxide products safely to ensure the best results. If this medication is accidentally swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. It's important not to share Veltin Gel with others. Some cosmetics and soaps can actually make your acne worse, but moisturizers may be safe to use. When you're buying skin care products, look for ones labeled non-comedogenic or non-acnogenic, as these are less likely to worsen your acne. If you're unsure about which products are safe to use, ask your doctor or pharmacist for recommendations. And remember, acne isn't caused by dirt, so avoid cleaning your skin too often or too vigorously, as this can irritate your skin and make your acne worse. If you happen to miss a dose of Veltin Gel, take it as soon as you remember on the same day. If you don't remember until the next day, just wait until your next scheduled dose. It's important to stick to the prescribed dosage schedule for the best results. When storing Veltin Gel, make sure to keep it at room temperature and away from light. It's important to note that the gel preparations are flammable, so be sure to keep it away from any heat or fire sources. Also, remember not to freeze it. And as with any medication, always keep it out of reach of children and pets. When it comes to disposing of Veltin Gel, make sure not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.